Do you need a new patient coordinator? Now, when I ask you that question, your first thought might be, what is a new patient coordinator? If I don't know what it is, how do I know if I need one? Well, that's what I want to get into in this week's tip. What a new patient coordinator is, when you might need one, and what they would do in your practice. So what is a new patient coordinator? It's sort of a newer thing. Just like treatment coordinator, to be truthful, is a bit of a newer thing in the dental industry. I started hearing of treatment coordinators back in the 90s. Mainly they worked in orthodontic offices. That was where you first heard of treatment coordinators. You didn't see them in dental practices. Normally, treatment plan presentations were done by the financial coordinator or office manager. Now we have a lot of dedicated full-time treatment coordinators. So what is this new patient coordinator? Well, basically, the new patient coordinator's job is everything new patients. From taking the new patient phone call and handling the intake form, to greeting the new patient when they arrive in the practice and giving them a tour of the practice, to getting referrals from these new patients, as well as current patients, to filming any testimonials from these new patients, to marketing aspects of the practice, from whether you're doing mailings, managing your Google, or at least interfacing with the marketing company, taking testimonials that you're filming and putting them on YouTube or putting them on your website and things of that nature. Basically, anything having to do with the new patient would be the purview of a new patient coordinator. So now the question is, do you need one? Well, there's a couple ways of measuring this, because as a business grows, you hire more employees. And I'm not talking about more employees who do the same thing. For instance, as you become more productive and you have maybe one dental assistant, you'll hire a second and maybe a third eventually. They're all kind of doing, maybe they have dedicated specific jobs, but the general nature of what they're doing is similar. Maybe you have two experienced assistants and one inexperienced one who's running sterilization or something like that. They all work in the same area. What I'm talking about is, let's take the front desk as an example. If you divide the front desk up into the various areas or zones, you have the phones, you have the schedule, and that would include the hygiene schedule, you have finances, which includes insurance and treatment presentations, right? Insurance verification, things of that nature. They're all different areas, so to speak. So when you start a smaller practice, it might just be the office manager doing everything. Then eventually they hire somebody to answer the phone and schedule patients. Then eventually they hire somebody to do insurance. You're splitting all of these roles off as the practice grows. But let's talk about this new patient coordinator for a second. Whether you have one or not, someone has to be responsible for new patients. So if you don't have one, who's responsible? I'll sit down with a doctor and office manager and we'll be looking at their statistics. And I'll pull up the new patient statistic and I'll say, who's responsible for new patients? Let's say they don't have a new patient coordinator. And the answer I'll get from either the doctor or the office manager is, I guess me. I guess me. That's the last thing you want to hear when you're looking at who's responsible for something. But the bottom line is that's true. Someone is responsible, whether there's someone doing the job or not, or someone's doing the job from the side while they're doing 5 other jobs. Whether someone's posted on that position, that job still exists. So these functions that the new patient coordinator picks up still exist in the practice. You're just getting somebody to do them full time. So this all started with whether you need one or not. Well, the first question would be, if you want to get more new patients and you're in a position to where you could hire one and you want someone who's fully responsible and accountable for new patients, that's where you have a new patient coordinator. What would their statistic be? New patients. So if I have somebody and I can, swing the salary, and I'll get into that in a second to whether it justifies hiring one or not, their job is to get me more new patients. So if, let's say, I'm getting 20 or 30 a month and I hire a new patient coordinator because I want to get up to 80 or 100, that would make sense. Okay? And that's their job. And if they're doing their job well, I have 80 to 100 new patients a month and everybody's happy. So that's the first aspect of it. The second one is, can I justify hiring one? Well, that depends a lot on the volume you have in the practice, or at least the anticipated volume that you're looking at. If I'm getting a bunch of new patients and you have multiple providers and you already have a lot of people up at the front, you have a bigger practice, maybe not even that big. It might just be 100, 150 a month or something like this. I would analyze how much incoming potential new patient traffic you are getting. We've talked about in these tips before that the average conversion rate in the United States with new patient phone calls is 23%, meaning out of 100 phone calls the average dental practice gets in the United States, they only schedule 23 of these people. That means that's 77 lost opportunities. So if you're spending all this money on marketing, tons of money on Google ads and Facebook and this and that, whatever, and your conversion rate is terrible, if you had somebody who really knew what they were doing and was taking full responsibility for that, they would pay their salary just by increasing your conversion rate up to 50%. You see? So the first thing you might want to look at is how much incoming new patient traffic am I actually getting? Look at, if you have a new patient log that's actually being kept, you could look at that. You could look at the various dashboards you have for various types of advertising you're doing. If you're getting, 5, 6, 7 new patient calls a day, or even three or four, it might help to get a new patient coordinator, especially if you've got some marketing in the wings that you want to start doing. Then you have somebody who's running that marketing, handling those new patient calls, who's really an expert at conversion, as well as chasing up the patients in the practice, asking for referrals, as well as when you have all those before and after pictures that you want to put on the website, or those happy patients that you want to film testimonials for, you have someone to do that. Because a lot of those functions normally in a practice are done when people have time, but unfortunately they're vital functions if you want to, promote your practice, as well as, for something as simple as getting more reviews. I mean, you need at least 300 reviews to be considered, especially in this day and age, to be considered, I don't want to say legit, but, established. So this person's grabbing reviews, testimonials, they're bringing all the new patients in. Then if I have that volume, it would make sense to have a new patient coordinator. The last point I'll throw out there with regards to this that's kind of important is when you're analyzing this new patient volume, what I would do is I would listen to, take about 2 to 3 months based on the current staff that you have, but take about 2 to 3 months and randomly listen to several new patient phone calls, okay? And I would actually observe also while my staff were handling the phones. If I see that the staff up front are overloaded, they're having to put people continuously on hold when they're calling in because there's a patient checking out and the phone is ringing at the same time, there's a good chance that might be part of the problem with my conversion rate, and I may need a new patient coordinator. And this is where corporate has the average private practice beat. If I call a corporate practice, okay, and I want to schedule as a new patient, I'm not calling the office in most cases. I'm calling a call center with somebody who's specifically trained to schedule me. Well, that's your new patient coordinator. This is where you can start playing on the same level. We even have clients who have full call centers just to take new patient calls, just like a corporate office, so that these new patients aren't put on hold, made to wait, have somebody who's in the middle of 5 different things trying to answer their questions. It's just something that you want to think with this new patient coordinator position. Folks, that's all I have for you this week. I do have some free new patient-related handouts, including intake forms and things of that nature. You can get them, you can download them by clicking the link in the description below. Otherwise, if you want to find out more about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. And lastly, if you want to see more videos like this, don't forget to subscribe and hit the notification bell so you're notified every time a new video comes up. Folks, again, have a great week, and we'll see you the next tip.